Testing, testing. Testing. Dr. Ferrer's mic, testing. It's a buzz. Test. Testing, testing. Sound check, 1, 2. Sound check, testing. Sound check, testing. Okay. More than normal? Testing, testing. Dr. Ferrer's microphone, testing, testing. 1, 2, 3, testing.
Um, okay. Good afternoon and welcome to today's COVID-19 media briefing. Today I'll share our current status as well as guidelines and measures that can continue to protect those most vulnerable while helping to limit unnecessary transmission of a virus that's still a danger to many residents and workers. Next slide. I want to start by noting some changes in our reporting cadence. Throughout the pandemic, LA County has provided daily reporting on COVID-19 cases, hospitalizations, deaths, and some related metrics. Beginning next week, we'll move to weekly data reporting, which is in alignment with the current reporting schedules for the CDC and the California Department of Public Health. LA County's weekly case, hospitalization, and death data will be posted online each Thursday. Rather than releasing the number of newly reported cases and deaths per day, we'll instead release the number of newly reported cases and deaths per week. With lower case and death numbers, weekly reporting will smooth out some of the natural fluctuations in daily reported numbers and will not affect our ability to track trends over time. Should we see large increases in any of our metrics, we're likely to return to more frequent reporting. Next slide. As we do every week, I want to start the briefing by looking at our trend lines, and today we can see the data from March 2020 through the present. As we move to weekly reporting, I do want to note that we also are making a small switch in the way this data is being presented. Previously, cases and deaths were graphed by the date they were reported publicly by the Department of Public Health. Now deaths are graphed by the actual date of death, and cases are graphed by the episode date, which is the date of symptom onset or the date the positive test was taken. As we look at the data, you may notice there was a large peak in January of 2021, that's the first winter of the pandemic, and then another large peak in January of 2022. You can see that we did not see a similarly large peak this past winter, and in fact our numbers this past winter look closer to what our summer peaks generally have looked like. The green trend line shows the 7-day average of daily cases by episode date, and it's measured using the vertical axis on the left. We're currently averaging 360 cases per day. This is a welcome decline from an average of 540 cases that was a couple of weeks ago. This line captures large shifts in transmission, but it cannot be considered a true count of cases due to the large amount of in-home testing. The orange trend line shows the 7-day average number of hospital admissions. This past week, there was an average of 52 admissions per day. This is a decline from the average of 69 admissions just a week ago. And while we're pleased with the continued decline in hospital admissions, in late March through early May of 2022, I want to note that there was a 6-week time frame when the 7-day average for hospital admissions remained under 35, with a low of 22 daily admissions. We'd welcome seeing a similar decline this spring, as residents can continue to take advantage of all the tools to keep people from experiencing severe illness should they become infected. Vaccines, boosters, testing, and therapeutics remain free and easily accessible in LA County. The blue line on this slide shows the 7-day average number of daily deaths, and it's measured by the axis on the right. Sadly, there are currently an average of 5 deaths a day, which means that mortality rates remain relatively high for a respiratory illness. With almost 36,000 LA County residents dying from COVID-related illness, I offer my heartfelt condolences to those who have lost a loved one to COVID-19. I wish you all peace and healing. Next slide. While the trend line for cases is an approximation based on cases reported to public health, Wastewater provides us with more accurate information about transmission levels in our community. This is because the wastewater data tracks the virus levels of SARS-CoV-2 in wastewater, and it's not dependent on cases reported or captured through testing. On this slide, we have SARS-CoV-2 wastewater concentrations from September 11th 2022 through March 18th of this year. As a reminder, we have two different graphs on this slide in order to utilize data from Wastewater Scan, which is a collaborative of the largest 3 sewer sheds in LA County. Samples from the Tapia sewer shed are analyzed by a different lab, and therefore we're presenting them separately. The Wastewater Scan data includes samples from the Joint Water Pollution Control Plant, Hyperion, and Lancaster sewer sheds. The blue line is a weighted average for viral concentrations across these 3 wastewater treatment plants, weighted by the population served by each plant. The most recent wastewater data we have is from samples collected during the week that ended March 18th, because it takes time for the samples to be analyzed and reported to us. Looking at the main graph, it's clear that our current wastewater concentrations are substantially lower than what we saw during the peak of our most recent winter surge, and that they remain stable at a lower level. This week, the concentration level is 21% of the winter peak, indicating that there is low concern for rapid spread of the virus. The bottom graph in the corner, that green line, shows the wastewater concentrations from the Tapia sewer shed. For this sewer shed, we are also seeing the same pattern, with concentrations substantially lower than the winter peak and generally stable this past month. But as you can see on the graph, there are some frequent fluctuations in wastewater concentrations, and these are likely to continue in the near future because they reflect the reality that COVID-19 continues to circulate amongst those living, working, and visiting LA County. Next slide. Using the CDC's community levels framework, which looks at the case rate and 2 different hospitalization metrics, this week, LA County remains in the low community level for the 11th week in a row, with a reported case rate now of 34 new cases per 100,000 people. This is lower than the 41 cases per 100,000 people reported last week. Sorry. For the first hospitalization metric, the number of new COVID-19 admissions per 100,000 people, LA County is currently at 3.7. This is down a little bit from 4.5 last week. For the second hospital metric, this is the percentage of staffed inpatient beds occupied by COVID-19 patients. LA County is currently at 2.3%. I think last week we were at about 2.6%. The continuing decline in hospitalization metrics is a positive sign, especially since, as we'll see on the next slide, hospitalizations decreased despite big increases in the circulation of the newest strain of the virus, XBB.1.5. Next slide. On this graph, you see the variance as a percentage of all specimens sequenced in LA County as of March 4th. Again, a reminder, we have a 3-week lag in lab data due to the time that it takes to sequence the specimens. The current circulating strains represented here are all descendants of Omicron, and we're not seeing any new variants or rapid rise of any new strains. XBB.1.5, that large, I think it's an orange section at the top of the bar, accounts for about 84% of sequenced specimens in LA County as of March 4th, and it does remain the dominant strain in LA County and nationally. We've added 2 new strains to this graph, XBB.1.5.1 and XBB.1.9.1. We add new strains to our graph when the CDC adds strains to their variant tracker dashboard, which happens when the strain accounts for 1% or more of sequenced specimens nationally. Both XBB.1.5.1 and XBB.1.9.1 are still circulating at relatively low levels nationally, accounting for about 2% and 5% respectively of sequenced specimens. Both strains are most common in the central part of the country, including Iowa, Kansas, Missouri, and Nebraska, with XBB.1.5.1 accounting for slightly under 4% of sequenced specimens in this area, and XBB.1.9.1 accounting for about 16% of sequenced specimens in this sort of Midwest central part of the country. In LA County, we're reporting 1.9% of sequenced specimens are XBB.1.5.1, and 0.4%, not even 1%, are XBB.9.1. However, I do want to note that the CDC data that I mentioned earlier are modeled estimates for what is circulating right now. And as I noted, our LA County data is measured data for the week that ended March 4th. XBB.1.5.1 is a descendant of XBB.1.5, and based on the currently available data, it has no notable advantages over XBB.1.5, so we don't think it's likely to crowd out XBB.1.5. XBB.1.9.1 has the same mutation that XBB.1.5 has, which has been linked to immune evasion and higher transmissibility. However, XBB.1.9.1 has been circulating in Europe since January and has not yet taken over for XBB.1.5 or resulted in increased case counts. So far, neither XBB.1.5.1 nor XBB.1.9.1 are associated with an increased severity of illness, but we will continue to watch these strains closely. Given the information currently available, we don't see them as a cause for increased concern at this time. Across all the other strains we're tracking, you can also see we have no significant shifts. With no sign of a new strain with novel mutations or a high likelihood of rapid growth in the strains that are circulating, we feel fairly confident that we're going to enjoy another stable spring. Next slide. As we reflect on the impact of circulating new strains, we continue to see evidence that the bivalent boosters are an effective tool at reducing risk associated with all of the circulating Omicron strains. On this table, you could see the hospitalization rates per 100,000 people for the 90-day period that ended March 14th, stratified or grouped by age. The first row shows hospitalization rates for people who are vaccinated with the updated bivalent booster. The second row shows rates for people who are vaccinated yet have not received the updated booster. And the third row shows rates for people who are unvaccinated. I'm going to start with the far column showing hospitalization rates for people ages 80 and older, because as you could see, these hospitalization rates are the highest. Within this oldest age group, people who are unvaccinated are 1.5 times as likely to be hospitalized when compared to those vaccinated without the updated booster, but they're more than 2 times as likely to be hospitalized when compared to people who are vaccinated with the updated booster. Older residents, as you can see, are more likely than many others to experience severe illness. This is likely because they tend to have weaker immune systems and more underlying conditions due to their more advanced age. The protective factor of the bivalent booster is more pronounced among those ages 65 to 79. The hospitalization rate for unvaccinated people in this age group is 10 times higher than the rate of hospitalization for those who have received the bivalent booster. While the hospitalization rate is lower for those ages 65 to 79 who are vaccinated without the bivalent booster, when you compare them to those who are completely unvaccinated, it's still over 2 times higher in this group of vaccinated without the bivalent booster than it is for those who received the bivalent booster. We see a repeat of this pattern across all the age groups, where hospitalization rates are substantially lower for those who have received the bivalent booster. I strongly believe that the updated booster has a significant role to play in reducing severe illness and keeping hospitalization rates low in this near future. Next slide. This slide examines death rates by age groups for the 90-day period that ended March 7th. Similar to the previous data on hospitalizations, unvaccinated people 80 years of age and older are over 4 times more likely to die than those 80 years of age and older who've been vaccinated and booster. There's clear evidence that the bivalent booster adds protection even among those vaccinated, with the death rate in the vaccinated and unboosted group 2 times higher than the death rate among those who received the bivalent booster. People ages 65 to 79 who are unvaccinated are nearly 11 times more likely to die compared to those in the same age group who have the bivalent booster. And those who have vaccinated but didn't yet receive the bivalent booster are over 2 times more likely to die compared to those in this age group who received the bivalent booster. Along with clinical studies, this data demonstrates the significant protection provided by the bivalent booster against hospitalization and death across all age groups. And this is especially important for older residents who, as we know, face the greatest risk. While the continued affirmation that our vaccines and the new bivalent booster work well is great news, only 42% of eligible LA County residents 65 and older have received this bivalent booster. We'll need to be sure that those at higher risk understand the importance of reducing their vulnerability, even during times of lower transmission, by protecting themselves with the bivalent booster. Next slide. With the rescinding of many emergency orders these past weeks, there are questions about which sensible protections remain important to consider. Given the differing risks, both by setting and by individual characteristics, the goals of reducing disruptions and taking care of those most vulnerable remain important. Cal OSHA continues to set the standards for workplace safety in California, and these standards apply to most work sites, including schools. However, the Cal OSHA regulations apply only to employees at schools. Our newly issued school guidance aligns both with Cal OSHA requirements and the state California Department of Public Health recommendations. Per Cal OSHA, if a staff member tests positive for COVID-19, they cannot be at the school for at least 5 days. During days 6 through 10, staff members who have had no fever for 24 hours and have either subsiding or diminished symptoms may return to school. If they do return to school, they must wear a mask when around others for the total of the 10 days after they tested positive or became symptomatic. Students who test positive are also required to stay home for at least 5 days, and if they return to school between days 6 and 10 because they're fever-free and their symptoms have improved, they should wear a well-fitting mask around others for a total of 10 days. This is not a requirement, but a strong recommendation. With a COVID exposure, schools are required under Cal OSHA regulations to identify and notify any and all employees who had an exposure to a COVID case during the case's infectious period at the school. There is not a similar requirement any longer for notification among students who have been exposed at school, although public health strongly recommends that schools notify the parents of students who were exposed to a case of COVID-19 during its infectious period at school. This notification is helpful at reducing spread, because those who know they have been exposed can monitor themselves for signs and symptoms and test themselves both immediately after a known exposure and then again between days 3 and 5. Testing, as a reminder, continues to be free, easily accessible in LA County, and I want to note that free at-home test kits should be available at just about every school across LA County. Next slide. As part of long-standing efforts to reduce risks associated with infectious diseases, including COVID-19, we continue to require businesses and facilities to report clusters of COVID-19 cases to public health. This allows for early and effective intervention by public health outbreak investigators, reducing disruptions and transmission at sites. Throughout this slide, you'll see we use this term called linked cases. Linked cases refer to people who had a close contact or were present in the same setting during the same period of time while they were infectious. For example, if 3 employees at a company test positive, but they all work different shifts or in completely separate areas, those would not be linked cases. On the other hand, if 3 employees who all worked the same shift and spent time together tested positive, those would be linked cases. In workplaces, educational settings, residential and residential congregate settings, including shelters and correctional facilities, public health needs to be notified within 24 hours of all clusters of at least 3 linked cases occurring within 14 days, or in larger work settings where there are over 100 workers or residents, when 5% of the workers or the residents test positive. Healthcare facilities need to report outbreaks to public health when they know of at least 2 linked COVID-19 cases identified in patients 4 or more days after admission. This indicates that the patient acquired the infection at the facility, or when they have 3 linked cases among staff within a 14-day period. In skilled nursing and community care facilities, the reporting requirement takes effect whenever there's at least one case in a resident or 3 linked cases among staff. All reporting, as I noted, needs to take place within 24 hours once a facility knows that their cases have met the public health reporting thresholds, and these thresholds haven't really changed. This will serve as a vital alert in our efforts to identify outbreaks and address them so that we can work together to reduce the spread of COVID-19 in our community and alleviate disruptions at our workplaces. Next slide. The information that is provided through case cluster reporting does allow public health not only to provide valuable information at sites with outbreaks, but it also allows us to identify sectors where there's more transmission. This is a slide you've seen for the last 3 years. It shows the average number of open outbreaks in various sectors. This goes from March of 2020 until now. As you can see, there have been thousands of outbreaks across a wide variety of settings over the course of the pandemic. Even during times of low community transmission, outbreaks happen. As of Wednesday, March 29th, Public Health is investigating a total of 126 outbreaks. The majority, as you can see, are in our skilled nursing facilities. Having sites report clusters to public health allows us to monitor transmission and intervene early to help sites protect vulnerable residents and workers and assist facilities improve their infection control practices. Next slide. Cal OSHA has also issued regulations requiring certain actions at workplaces when there are outbreaks. Under Cal OSHA regulations, when an outbreak occurs, work sites, including schools, must make free COVID-19 testing available to exposed employees, both immediately and then again a week later. Work sites are required by Cal OSHA to continue to make tests available to employees at least weekly until the workplace no longer qualifies as an outbreak. Cal OSHA requires that all employees who have had close contact with a known COVID case and remain at work take a COVID-19 test within 3 to 5 days after they had a close contact. Employees who test positive for COVID-19 or don't take a COVID-19 test within 3 to 5 days after exposure are excluded from the workplace until the return to work requirements set by Cal OSHA for COVID-19 cases are met. And per Cal OSHA, all exposed employees, regardless of their vaccination status, must wear a face covering when indoors or when outdoors and less than 6 feet from another person for 10 days from their last exposure. Next slide. So vaccinations and masking, as we've talked for the last 3 years, do remain some of our best and most effective tools to reduce COVID-19 transmission and minimize the impact of COVID-19. And you can see that Cal OSHA has acknowledged the important role of masking when there are exposures at work sites. While for many, though, masking and vaccination protective measures are now recommended and not required, because there are so many vulnerable people in healthcare settings, enhanced protections in LA County among healthcare workers remain in place. Under a new health officer order that'll go into effect on April 3rd, healthcare workers will be required to wear a mask during patient care or while working in patient care areas. Requirements for masking by visitors and patients is at the discretion of the facility, although public health strongly recommends that facilities continue to have their patients and visitors in public areas wear masks. At all Department of public health clinics and vaccination sites, everyone will be required to continue wearing a well-fitting mask, and free masks will remain available for workers, patients, and visitors. New healthcare employees will need to comply with the existing vaccination requirements. All currently employed healthcare workers have completed their primary series and 1 booster dose, or else they received an exemption from their facility. There are similar federal requirements for healthcare workers in facilities that accept Medicare and Medicaid funding, which is most of our facilities. Public health will reassess the vaccination and masking protections for healthcare workers by September so that we can take into account any changes in the CDC and FDA vaccination guidance. Next slide. As a reminder, you all know the local LA County COVID-19 emergency declarations end today. March 31st, 2023. This doesn't mean that COVID's no longer with us. It does mean that the investments made to date have resulted in robust tracking methods, ample testing capacity, and effective vaccines and therapeutics. As long as there's an appropriate allocation of resources, we are confident that we can continue to protect each other, those most vulnerable, and our healthcare system. At Public Health, we remain committed to continuing to provide free vaccinations, testing, and treatment to LA County residents, and we don't need an emergency declaration to do that. In terms of public health protections, very little changes with the lifting of the county emergency declarations. However, we know there are other changes the public should be aware of. There's a moratorium for evictions for renters that's lifted today, and although it's important to note that there are programs and regulations in place to help those struggling, folks who need more information should please visit lacounty.gov/COVID-emergency-ending for all of the details. With no new strains proliferating, I'm optimistic that we'll remain in the low community level this spring. And my hope is that our hospitalization and death rates continue to decline. I would love to see our lowest ever numbers since the pandemic started. That hasn't happened yet. I think in order for it to happen, we'll need to take advantage of all of the tools and resources that helped us get to where we are today, and to be aware of how our actions affect those in our community who are most vulnerable to severe illness. I now welcome your questions.
Dr. Burke, a question. The CDC is recommending a vaccine like the flu vaccine every fall. What do you still recommend people do in terms of getting the booster, getting the vaccine?
It's a great question. Thanks for asking. One thing is we know that the CDC and FDA have been meeting internally to discuss whether or not here in the United States we should issue recommendations that people who are at the highest risk, either by age or underlying health conditions, get another dose of the bivalent booster now, or within 6 months of their last dose. Many people went in September and got that bivalent booster, so lots of people at higher risk are asking whether or not they need their other dose, and we're waiting for guidance on that. We do welcome the possibility that where we're headed is to have an effective annual vaccine for COVID that's given at a similar time as we all get our flu vaccines. That certainly makes it easier. We can, as we all know, get both vaccines on the same day, one in each arm, and then we'll have some protections going into what is usually the season with the highest number of respiratory viruses.
And just following up, what does this day mean for you, this milestone after 3 years?
Yeah, I mean, we're really glad to see so many fewer people dying and so many fewer people hospitalized. We feel so blessed to be in a country where we've had really ample supply of the tools that got us here. The vaccines, the boosters, the tests, these rapid tests, and therapeutics. I mean, those of you who can remember back in 2020, we said the game changers for how we get through this pandemic would be an effective vaccine, rapid tests that you could take in the privacy of your own home before you went out, and good therapeutics that, should you get infected, really will reduce your chances of severe illness. And we have all of that. And we have an ample supply of all of that here in LA County. So we feel very, very good about where we are and our ability to continue to protect those most vulnerable. Thank you.
Is today your last weekly briefing?
Today is, we haven't really been doing weekly briefings for the last, I don't know, maybe 2 months. We've really tried to move to a schedule where we do every other week briefings. Right now, we'll probably continue a cadence of doing regular briefings when there's information that it's important for us to share. As I've just previewed, we have a feeling that we're headed into a relatively stable spring. So, unless we have new information about variants that are circulating, or we start seeing some increases, or there are changes in what we're asking each other to do to help protect each other, I think the cadence of a weekly briefing is probably something of the past, and hopefully we don't have to reinstate them, in the future.
Let me ask you, if I could, just looking back on the last 3 years, what a ride it's been, and given the fact that the emergency ends today, what are you most proud of, and what do you look back on that you wish that you would have handled things differently? With that said, lessons moving forward, that God forbid there be another pandemic, what would you do differently?
Yeah, thanks a lot. That's a great question. I think, not just what I'm most proud of, but I think our entire team at Public Health is most proud of, is the partnerships we built with community-based organizations, with faith-based organizations, with healthcare organizations, with residents, to actually be able to create a network of services and support that allowed many of us to get through this pandemic. That couldn't have been done without tremendous leadership from the Board of Supervisors, from the mayors, from other elected officials. But it really was the team that were working on the ground to deliver services and support that made the biggest difference. In LA County, we have over 2,000 sites where people can get vaccinated. And every week we still offer over 600 mobile teams. That's remarkable and only happens because of the partnerships.
And what would you do differently?
I think one of the lessons that we learned is how important it is to figure out how to be effective communicators. I think we really learned, and mostly from hearing from residents, that the personal touch matters a lot. And I wish we had been out very early in our communities, speaking with residents, trying better to understand what the fears were, what the anxiety was, what they needed in order to get through the pandemic. I'm grateful that we had teams of people who have been out there for the last couple of years, but I wish we had been able to start that earlier. I think building those trusting relationships makes a huge difference.
Dr. Ferrer, as far as free testing goes, can you outline what is still available in terms of PCR testing and antigen testing, and any distinctions between insured and uninsured residents?
Yeah, it's a great question. So up until now, the Department of Health Services has not only offered testing to people using their clinics and at their hospitals, but they've also run community testing sites. In times of high demand, we've had more community testing times. In times like now, of very low demand, we have less. Those testing sites were primarily using PCR tests. As we all know, PCR tests do have their place. They're a confirmatory test, particularly for people who have symptoms and keep testing negative, and they're used a lot at healthcare facilities. But rapid tests, those over-the-counter tests, are really dominating in terms of what we're using to find out our own status. So the community testing sites that are run by the Department of Health Services will be closing. There are still other, I want to be clear about this, there are still many other community sites where people can go get tested, and some of those sites still offer PCR testing. Almost all of our large healthcare systems also offer PCR testing. Here at the Department of Public Health, what we're taking over is increasing the distribution of those free over-the-counter tests, so that faith-based organizations, community-based organizations, as I noted, schools, community sites, all of our sites, all of our mobile team sites, they all are able to distribute those free over-the-counter tests. And again, for people who are insured, as a reminder, your health plan is still required to provide you with 8 free tests every month. And the federal government still has opened their free test site where you can order 4 tests for your household.
As a quick follow-up to that, as people navigate some of these changes, because there are so many different levels of government that have funded free testing, as people try to figure out where they need to go, do you have any recommendations on how to figure that out when there's overlapping layers of government?
I mean, I think our website is a great place for everyone to go for information. And, I want to note, we have a call center. It's open from 8 in the morning till 8:30 at night. You can call that call center. We'll answer any questions you have about COVID, including if you say, I need to get tested and I don't know where to go, or I went somewhere and they tried to charge me, I don't have money, I don't have insurance, and I want free tests. There are plenty of places distributing those free tests, but you're absolutely right, that might not matter to a person who doesn't have that information.
Doctora Ferrer, 2 preguntas en español. Primero que nada, ¿qué ocurre a partir del lunes con el uso de mascarillas? ¿Quiénes tienen que seguirlas utilizando y dónde? Y segundo, si nos puede hablar sobre la distribución de vacunas, pruebas para la comunidad que no tiene seguro.
Déjame empezar con la pregunta de las vacunas y las terapias. Esos todavía están gratis por todo el condado. Gente que necesitan una vacuna o el booster o necesitan la medicina si están enferma con COVID, por favor, pueden llamar al número de teléfono que nosotros tenemos durante las horas de 8 en la mañana y 8:30 por la noche para conseguir un sitio donde puedes sacar las vacunas y las terapias gratis. Para la primera pregunta, generalmente los únicos sitios donde gente tiene que quedarse con las mascarillas son dos. Los sitios donde el edificio o la tienda te dicen que tienen que tener una mascarilla, o cualquier sitio por todo el condado te pueden todavía decir que tienes que tener la mascarilla para entrar. En esos sitios todo el mundo, por favor, ponen las mascarillas porque eso sí es la regla. Los otros sitios donde la gente tiene que tener las mascarillas son la gente que trabajan para sitios médicos, en edificios o están cuidando en la casa una persona que está enferma. Esa gente todavía se tienen que quedar con las mascarillas cuando están disponibles a darle servicios al público o cuando están en sitios en los edificios donde hay pacientes.
Gracias, doctora.
No hay de qué.
Dr. Ferrer, I have some questions submitted by Ron Lynn at the LA Times. 3 questions. I'm going to go one by one. Okay. His first question. I understand the county has provided general guidance that people stay at home for at least 5 days following a positive coronavirus test or initial COVID symptoms, but is that still an order or just a recommendation? And for workplaces not undergoing an outbreak, does Cal OSHA order infected employees to stay home for at least 5 days?
Yeah, these are good questions. In LA County, we do ask that you stay home. There's no official order. We could issue individual orders again around isolation and quarantine, but those are the rules. If you're infected, you need to stay home. I want to note that we get this question from parents as well. I want to note that there are regulations already in place, have nothing to do with COVID, that require parents to keep their children home if they have an infectious disease. So I just want to say, none of that changed. We don't send children to school when they're sick. We particularly don't send them to school when they're sick with something where they're capable of infecting others. And in this case, the period of time that we're requiring people to stay home has been shortened from 10 days to 5. But you can only leave after 5 days if your symptoms are either gone or they're improving and you've been fever-free without medication for 24 hours. At work sites, you're going to need, if you're returning after that 5th day, after you've been infected, you're going to need to wear a mask. You're going to be required to wear a mask. In all other places, of course, we strongly recommend you keep your mask on.
Second question. Nationally, since October, there have been at least 69,000 COVID-19 deaths, about double the average of the annual flu deaths. Do you foresee COVID becoming as mild as the flu at any point?
I hope so. I would love that. I think we'd all love that. We're certainly not there yet. I think, there still remain the unknowns of the mutations that we may experience in the future. I think the good news is with the strains that we're seeing in Omicron, it appears likely that while there may be highly transmissible strains circulating, they aren't causing as much devastating illness. I think you could say that that's due to the evolution of the virus, or you could say that that's due to the good therapeutics we have and the protections that people have gotten both through natural immunity and for boosters. The good news is that illness severity is definitely decreased.
All right, Ron's last question. You mentioned a few weeks back that you've started to resume eating at indoor restaurants if the ventilation seems decent and an outdoor option is not available. Now, some older folks are still avoiding indoor restaurants. Do you think there will ever be a time when the risk will be reduced further that vulnerable people can feel safe eating indoors?
You know, I don't think any of us could answer that question for other people. I want to be super respectful. Because I hear a lot from people right now who are super concerned. They're very vulnerable. Some of them have gotten extraordinarily sick. Many of them are living with cancer or other immunocompromising diseases, and they are at much higher risk. And I applaud people for taking care of themselves and asking us all to help do our part to take care of them. And I think for some people right now, it probably is a good idea for them to continue to order out or eat outside because they are at very high risk. I think for other people, they're not as high risk and they can feel much more comfortable resuming many of the activities that they love without that worry.
Hi, so CSU universities adhere to LA County Public Health. How do you think that enforces the consciousness of COVID?
Could you repeat that?
So CSU universities are adhering to LA County Public Health. How do you think that enforces the consciousness of COVID, specifically for higher institutions?
Well, I think it's always helpful, particularly at institutes of higher education where people are really on a learning journey, to pay attention to what we know, what the science says, and then to take the appropriate actions. So I applaud all of our institutes of higher education because they've been great partners, and they've also done their part really trying to limit transmission on their campuses, knowing how disruptive it can be to have dozens and dozens of students or students and faculty sidelined by COVID.
Right. So to the students who don't feel safe for the depletion of guidelines, how do you
So this is kind of how I approach the world. I don't know if it's the right way or it's helpful to everybody. But right now we have a lot of tools that we can each use individually to keep ourselves safe, including that tool of reducing the number of places you go where you feel like the risk is too high. If you wear a well-fitting respirator mask, you've got a lot of protection. If you're boosted, up to date on your vaccines, you've also got a lot of protection. If you're testing regularly and you're asking people around you who you're gathering with to test regularly, that also adds a layer of protection. So I think even though some of the global rules have been relaxed, there's no need for us to relax what we do to take care of each other and to take care of ourselves.
Thank you.
You haven't gone yet.
Sí, voy a tratar.
Gracias. Bueno, para que la gente tenga básicamente una lista o unos bullet points de las cosas que van a cambiar desde hoy a las 12 de la noche, por favor.
De veramente los términos de protección de la salud pública, esta noche no vamos a ver muchos cambios. Sin embargo, cambios del Departamento de Salud Pública. Hay otros cambios, los cambios por la gente que están debajo de Medi-Cal, ellos tienen que hacer sus redeterminations. Hay gente que son alquilando donde viven, ellos tienen que saber que esas protecciones también hoy se terminan, pero para nosotros en el Departamento de Salud Pública no hay muchos cambios.
You know, the sound on this isn't that good. You could use yours. Sorry.
Okay. I'm just getting word that on Monday, on the 3rd of April, that county employees, which you are a county
Yeah.
employee, that the vaccine mandate for county employees sunsets on Monday, and that the board is going to introduce a motion on Tuesday for the contract county employees to stop the mandate for vaccination. Your your reaction to that, and does that hurt or hinder your pitch to get vaccinated?
You know, I hope that we're not relying on a mandate around vaccines to help improve our vaccination rates any longer. I think this is the time for us to really answer people's questions and address their concerns. We're many years out. We've had 2 years where the vaccines have been shown to be effective, and we don't really have serious side effects that are experienced by almost everyone who gets vaccinated. I think we need to use those stories and that evidence to help inform people who still haven't gotten vaccinated about the need to go ahead and get vaccinated. Now, this place we're in right now is unique because transmission is relatively low and hospitalizations are even lower. Should we get a new variant for which the vaccines that we've all so diligently gotten vaccinated with no longer work or don't work so well, and our natural immunity, which also the vast majority of people have now acquired, also provides little protection, and we have a new vaccine that seems like it will provide more protection, we may need to go back to where we were before. Because when the risk of what we have 1.1 million people in this country have died from COVID, I mean, that's almost unimaginable. So if you continue to have a situation where the risk is so high, you may have to go back to measures where you're using requirements. I don't anticipate us being there again. So I think in recognition of the new phase that we're in, it's really important for us to identify where the risks are the greatest and concentrate efforts in those areas, and for the general public, allow them to go ahead and get good information and make decisions. So healthcare workers, they still should be vaccinated. They deal with very, very high-risk patients, but we ask them to get vaccinated against other diseases as well. So this isn't unique to COVID. This is an understanding that in some fields where you're really providing services to people who are extraordinarily vulnerable, it pays to make sure you're not transmitting.
And given that the healthcare providers in this county
Yes.
Will be still required as of Monday, when the rest of the state isn't necessarily, it's now an
Yes.
option for healthcare providers to wear a mask. Can you explain your reasoning to keep it in place, noting that
Yep.
healthcare providers are highly protected, they're
Yep.
vaxxed, they're boosted, they're responsible healthcare providers, when
Yeah.
in fact patients would be able to walk in and not be masked
Yeah.
and they could be sick?
Yeah, I mean, it's really a question of when you're in very low transmission, where's the greatest worry? I mean, we obviously urge everyone who goes into a healthcare facility to wear a mask, and we think that's just sensible at this point. If it's not COVID you're worried about, we've had a lot of respiratory viruses. We've had, sort of high cases of norovirus. I mean, there's just, our systems, because we were not together a lot, because we didn't get sick a lot, our systems are really struggling to mount very effective defenses against all of the viruses that we may have, come across more frequently in the past. So I do urge people to keep those masks on. I do want to note that LA County is not alone. San Francisco County, I believe Alameda County, are also requiring extra protections in their healthcare settings. We have worked with the healthcare providers and heard from them that they would appreciate some flexibility at their sites about what to do with patients and visitors, because they've, obviously, as we've all seen, they've had some problems with compliance. I think many places are going to be like the Department of Public Health here, and we're going to require that our patients continue to wear masks.
But you'll reassess in September.
We'll reassess in September because we're anxious to see where CDC and FDA land on what is the sequencing for vaccines, so that we can line up with that. If it's going to be an annual vaccine, as you know, here in LA County, we require healthcare workers to get vaccinated against influenza every year. So we're likely to sort of look at what we're doing around influenza and try to align that with COVID.
Okay, thank you. And my last question is, this week, the largest hospital here in LA County and as you have done since
Yeah.
the beginning, and they were happy to report that despite not having to test every single person that goes to
Yeah.
the hospital, there hasn't been a COVID outbreak. And one of the doctors said that the pandemic is, quote, primarily over.
Yeah.
Your reaction to that?
Oh, yeah, I mean, I think lots of people are saying the pandemic is primarily over, and I think everybody means something different. I think most people in medicine and certainly people in public health acknowledge we're in a much better place and a new phase. And we're hopeful that the devastation we've seen the last 3 years is never going to hit us again. But I think reasonable people also know that we can't predict with 100% certainty what this future looks like with COVID-19, and we should just continue to be prepared.
Do you feel relieved after all these years?
Yeah, I mean, I feel relieved. I think for us, the biggest relief is that not as many people are dying in our hospitals. It is very hard to watch and hear the stories of the people who lost loved ones or people who are still pretty sick and very scared. So, you know, the relief is that, you know, as a community, there's much less risk.
Thank you.
Thank you. I think we're good. Thank you.